Now, once your scar's healed fully, all the sutures are gone and there's no scabbing, and you're starting to see the formation of the scar. Now we want to start some scar mobilization, because scars can heal very stiff, and that can significantly limit range of motion too. So the best way to attack the scar is to take your thumbs. We're going to put one thumb on one side, the other thumb on the other, and we're going to go up and down. So I'm mobilizing the surgical incision here in an up and down pattern. Modify the pressure as your sensitivity allows, but say 5 to 10 mobilizations, and then we're going to move slightly down. We're going to work our way all the way down the incision, working that scar and getting it nice and relaxed and loose so that it doesn't restrict our range. You're going to find there's going to be certain parts of the incision that are going to be stiffer than others, and you could spend a little bit more time there. So once we make our way all the way down, we're going to go left and right. So my thumbs are moving in the same direction. And I'm trying to really loosen up this incision all the way down. You'll often find there's one part of the incision that's a little bit more bound down, a little bit more raised, or just stiffer than others, and spend a little bit more time there. So once we go up and down, left and right, now we're going to do circles. We're going to do clockwise circles, about 5 to 10, and then counterclockwise circles. Clockwise, and then counterclockwise. So I would advise doing this, especially if your scar is stiff or raised. You might need to do this a little bit more, but anywhere from 2 to 3 times a day. And then as your incision starts to really relax, you can do it less and less. But a good early introduction of scar mobilization, once the incision has healed or is starting to scar down, really good to perform, so that later on you're not restricted due to the buildup of scar tissue. All the way down to the very bottom, and then maybe spending a little bit more time in those more restricted areas.